This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2026. Pilon fractures are ankle bone breaks that are associated with chronic pain and decreased mobility. The standard treatment for pilon fractures is external fixation followed by open reduction and internal fixation, or ORIF. However, while ORIF can be successful at fracture realignment and healing, there still exists a risk for posttraumatic ankle arthritis because of articular damage. An alternate procedure is Tibiotalocalcaneal or TTC arthrodesis, or hindfoot nailing, which is associated with fewer wound complications and faster recovery. Yet this procedure involves unnecessary violation of the subtalar joint. Thus, it is important to assess whether there exists a natural progression of subtalar arthritis after pilon injury, as this would potentially mitigate the worry of violating the subtalar joint with hindfoot nailing. Towards this aim, researchers collaborated to retrospectively determine the prevalence and severity of posttraumatic subtalar arthritis in 473 patients who underwent ORIF for pilon fracture. They categorized patients based on the interval between injury and radiography and graded the radiographs using the Kellgren-Lawrence or KL system. The KL grading demonstrated that patient-based factors like age, smoking status, steroid use, AO or OTA classification, Charlson comorbidity index, and the time since injury were significantly associated with development of subtalar arthritis. The development of subtalar arthritis after pilon fracture and ORIF suggests that acute hindfoot nailing as treatment may have fewer adverse consequences and may not sacrifice the subtalar joint as previously thought.